In order to maneuver around the Singapore healthcare funding, right, it involves mental gymnastics. So there are so many things, but we can actually improve step by step. So in our manifesto, the first step is actually for the government to pay fully, and we can fund it from other sources of income, right?
Yeah.
We look at the revenue streams and all that. So for the eldercare life and medishield life, which is the insurance portion of our healthcare system, to be fully funded by the government. If it's fully funded, what does it mean? That means you do not have to deal with it anymore. It is less of a complex maneuver on trying to understand what comes from what. That's one. Number two, also, these two insurance components, actually, the premiums tend to get up and tend to go higher when you age.
Yes.
You must remember this. When the premiums go up, but when you age, your income goes down.
Yes.
So there's a big disparity.
Yeah.
This is a time bomb. For the elderly, come 20 years down the road, when I'm not working, how am I going to pay a higher premium? Right. So that's why our party proposes that it should be fully funded by the government. And again, this is insurance policy, medical insurance. So and it can be funded. But of course, when we implement this is the first step. We will later on, if this is successful, then we will try to propose what else to simplify, like what you asked, to simplify the way we tackle healthcare. So it's a step-by-step approach. We cannot revamp everything. I don't think that's the right way too, because if you revamp everything, there'll be some segments that will not be happy, right? But if we say these two premiums will be funded by the government, then I think it's a good start. Yeah. And then we can get the buy-in of the citizens when we try to implement the next phase of the policy. I don't think we want to follow the UK policy. We do not want to put our citizens having to wait months more just to get critical help in terms of their health, right?
Yeah.
So it's not. So ours is a progressive approach. So firstly we try to tackle the premiums first, to handle the economic side of it, right? So the healthcare, the system itself continues. But if this gets implemented, rest assured that the PSP will have follow-on policies on how to improve, to simplify the healthcare system.